What are the physical qualifications required for truck drivers? This is FMCSA Compliance Q&A from Acrisure Truck Group. Take it away, Mark.
These physical qualifications are part of the process, meaning that not just anybody can operate a commercial motor vehicle unless they meet these physical qualifications. This is found in Part 391 of the Federal Motor Carrier Safety Regulations. So in general, you're physically qualified to drive if you have no loss of a foot, leg, hand, or arm, unless they've been granted what's called a skills performance evaluation, meaning that driver applied with their local DMV and worked through FMCSA counterparts, in that if they had an arm or limb that's missing, they had a special skills performance evaluation done, meaning they had a ride-along done with the evaluator to make sure they can still safely operate that vehicle, shift the gears, steer the steering wheel, activate the pedals in a safe manner. If they've met that requirement and they've demonstrated they can safely operate, even though they have this impairment, the skills performance evaluation certificate would be issued to that driver, and they have the ability to operate a CMV in interstate commerce. And that would become part of their driver qualification file requirements. Also look at the same thing as far as hands or fingers if it has any problems with grasping the steering wheel. And again, same thing with any foot or arm, leg that has that ability to have an issue. Again, that's where they're looking for that skills performance evaluation to show that it's a minor impairment, it does not affect their ability to safely operate. There's also the requirement you cannot have a clinical diagnosis of diabetes that's currently being treated for insulin. Now, there is a program that is out there that recently, in the last few years, if it's under control, FMCSA has allowed certain individuals with diabetes to still continue to operate. We'll talk about that shortly with that. Also looking forward to make sure the individual does not have any current clinical diagnosis. What we look at is heart issues, coronary issues, the ability to breathe. So those fancy terms there are mentioned, really their ability for the cardiovascular system in order to deliver proper oxygen and awareness to a driver so they don't have the opportunity to become unconscious or lose consciousness when they're driving. So what they're looking for is to make sure that driver is healthy, they don't have any of these deficiencies that would cause them to potentially lose control of a motor vehicle. In addition, they talk about the respiratory dysfunction, very similar to what I just mentioned, the high blood pressure. And again, these are things that they may have certain levels of high blood pressure, and those are identified in what we call the medical advisory criteria, which will let the doctors know what levels are acceptable, what levels can be treated, and if they are being treated, for how long they're going to certify a driver in a federal medical card certification date. So they're also looking for the not having any major muscular or neuromuscular or vascular diseases, again, that would affect the safe operation of the vehicle. They also are not looking for any current clinical diagnosis of epilepsy, anything else that could lose consciousness, or any other mental or nervous or organic or functional disease that also could adversely affect their safe operation of that commercial motor vehicle. So they're kind of the basic 9 things that FMCSA has carved out that said you must meet these qualifications physically before we'll allow you to operate a commercial motor vehicle. There's some additional ones here though, and that is going to be the vision. So looking for the vision to be at least the 20/40. But I can tell you that that also has had some changes here recently where they're allowing some variations to that. And I'll show you the form that would be submitted by a carrier for the driver for both a diabetes issue or this vision issue. There's a waiver program that they might be eligible for. And also they're looking for you to have some ability to hear the forced whisper. So there's a hearing audiological requirement for it. And I can tell you also that there's certain waivers out there with individuals who are unable to hear, that they're under a special waiver being monitored with FMCSA. And perhaps we might open up the door for more individuals with those particular physical impairments to become a driver if they are having a severe hearing impairment. But for now, there is generally have to meet the hearing requirements. There's also a prohibition, not only in your physical qualifications, but also in General Part 392 of driving a commercial motor vehicle, that you cannot use any Schedule I drug, amphetamine, narcotic, or any habit-forming drugs. Those would disqualify a driver from not being physically qualified to drive. In addition, you cannot use any of those, as I mentioned, Schedule 1s or other prohibited type of medications unless they're prescribed. So what those would be is those medically necessary prescriptions that a driver may be prescribed, and if that licensed physician prescribing it legally is indicating that it's not likely to affect the driver's safe operation, they may hold a prescription that allows them to safely drive that vehicle. A caution I say to many companies, and also what's kind of advised, even in Part 392 when I deal with prescription, is if you have a driver that's known to be on a medication that may be of concern to alertness or safety, you always want to have a letter on file from the doctor prescribing the medication. You don't need to know what the medication is, just that whatever medication they're on, it's not likely to affect the safe operation of that driver, and keep that within the driver's records. In addition, the driver cannot have any current clinical diagnosis of alcoholism. These are the two forms and programs that I mentioned previously. There is insulin diabetes program that under certain circumstances, they now are allowing individuals, if they're being treated by a doctor and they're being evaluated properly using this form, they may be able to operate in interstate commerce. In addition, there's the vision evaluation form that also is under certain circumstances with this form completed by the doctors and ophthalmologists. They may have the ability then to operate interstate commerce if they meet those minimum requirements.